Hey, good day. Welcome back to Mike's Diabetes World. All right, today's video is going to start now. Okay, as you've seen from yesterday's video, I was quite happy with my blood sugar. But it's 7.9. I have just done a Foley calibration and it came up at 8. Now, when I did the first video, I just had that correction. Now, a second correction. So my pump constantly tries to keep me at a better blood sugar. How does it do this? Well, it can give me the basal rate. It also may not give me a basal rate. Here, it gave me a smaller basal rate. That was correction. It doesn't tell me what the basal rate for me is set at 1.2. And that's 24 hours a day. The machine calculates the blood sugar. That is why when you get the 780 pump for the first, I think up to 72 hours, you're not going to be in auto mode. And auto mode is where it starts trying to read you and give you your insulin. So, no. Still acceptable blood sugar levels. For me, we treat anything less than a 6 as a low blood sugar. I will start by having a ginger ale. After 15 minutes, can move on to a pudding. The whole point of the plan is different types of sugar. Do I recommend this for everyone? No. Speak to your doctor. He or she are probably the best to determine what sort of plan will work for you. Current time in range, as we saw earlier, nothing's changed. 92% within range. Above 10 was 8. 92% time in range. Remember, this number ideally has to be greater than 70. So this is a win for me. Below is 3.9. Average sugar is 8. So, all in all, a good win. So let's move on. Time's ticking away here. We're going to talk about 2 low blood sugars. And stay tuned, we'll be right back. This channel is provided for informational purposes only. Contact your physician for any diagnostic or treatment plan. For years, a new diabetic for years? No, scrap that. New diabetes patients or type 1s feel, oh well, I feel so much better now. My blood sugars are down. They kind of sometimes will get into the hype of type 2s. Yes, I just did a video on that yesterday. But, and the whole thing about type 2 is lowering your blood sugars. And so type 1s can get caught up in this and keep trying to say, you know what, lower blood sugars are best. I'm going to keep mine really low as I can go, and things will be perfect. Does anyone else see a problem with this? If your blood sugars are kept too low, you're going to end up having hypoglycemia attacks. Some of them are going to be bad, some of them are going to be good. But keeping your blood sugars below even the 3.9 threshold is dangerous. You don't want to have your blood sugars kept at that range. Well, what range should you be kept at? You want it below 10, but higher than 3.9. A 5 blood sugar may work. It may work for you, and that's awesome. But keeping your blood sugar very low is not the best thing. Like I said, hypoglycemia. And for me, who's been through quite a bit, doesn't work. My body, and I think it was utilizing the insulin I injected at different times than when we were expecting it. This is why this pump is so necessary for me. It keeps my blood sugars stable. Okay? I can tell up here these icons. I have battery life, green, which is good. I have insulin, okay? It's in range, and I just calibrated. All of this helps, but it can go the extreme. And when you go the extreme, yes, you can start feeling low becomes your normal. You know, the sweaty and the shaking, that eventually your body won't recognize you being low. And that's an issue. There's a condition called hypoglycemic unaware. The other person I know who works here, who's a type 1, also has this. And while it's great and we think the initiative of trying to get your best blood work, or best blood sugars is awesome, it shouldn't be the only thing you need. Ideally, 5 to 8 is probably about where you should be hitting. But again, check with your doctor and find out what range he or she is trying to set for you. It's going to be that easy. Hey doc, what range should I be in? He or she will direct you, and then that's the area you should be kept at. Hypoglycemic unaware is terrible. I have been found, when we talk about having these hypoglycemic fits all over the place, I have been found walking aimlessly in downtown Vancouver, in the middle of an intersection at Kingsway and Joyce in Vancouver, just on the side of a road in a gutter almost, 41st in Cambie. I have collapsed at work, and type 1 diabetes, it always seems to be a tightrope walk. And this tightrope walk shows that you're great if you're on the tightrope. If you go too high, you feel like crap. If you go too low, your body has a built-in mechanism where it can identify that. But if you utilize it too often, your body's just going to say, okay, this is our new normal. You kind of did that at the early stages of when you were diagnosed or your son or daughter was diagnosed with type 1. You get accustomed to the highs. And people, when they start to come down and start control their blood sugars, will start feeling like, oh, I'm low. Oh, I've got to eat something. When in fact, when they do a blood sugar, they find you're not low. Excuse me. I was trying to fight that. But if you keep yourself at low all the time, two things can happen. Once your body will stop identifying the symptoms of you being low. Second of all, if you raise your blood sugar, you're going to feel, oh my God, I must be skyrocketing, when your blood sugar could be as low as 8, and you're feeling that way. And what do people do? Oh, I'm going to have to get more insulin. Our doctors now have given us the autonomy that we, for years, were striving. But you have to respect the disease. You have to respect, yes, insulin will control. Your blood sugars will look great. Your hemoglobin A1C will be spectacular. So will your time in range. But overdosing with insulin is not the key. Now, oh, of course, yeah. It's not here when I want it. Just give me 2 seconds here. Here, okay? 92% time in range. 8% above, 92%. I don't always talk about this number here. If you're having more than 4% below 3.9, that's an issue. And your doctors don't want you to develop hypoglycemia unaware. I could be sitting here talking to you and my blood sugar could drop and I could keep talking to you. When I go low, I will keep talking and then eventually just pass out. If I start feeling anything, I know we have a major problem on our hands. So keeping your blood sugar too low is not the best. Above 3.9, so for me, I aim at 5. Could be your doctor could want you at 8, but for me, anywhere above 5. We start treating blood sugar lows at 6 because out of the blue, I will start trending down, and I trend down quickly. The pump has given me a little bit more stability. The problem with hypoglycemia unaware is A, you don't feel anything. Okay? You can go on your merry way. So having sensor that you can see on your phone, see on your pump, Freestyle, CGM, all work. You can be on the Freestyle CGM and not tied with an insulin pump. They can be expensive, but just seeing, hey, I'm feeling low, beep, seeing what your blood sugar is. is a godsend. I recently did a video about having too high blood sugars and how close you could be going into DKA. And if you go into DKA with the high blood sugars, you can get violently ill. Very quickly, very fast. Hello, being there. The other side, if you keep your blood sugars too low, you can lose the sensation. You can also be talking away or walking down the street and collapse. That's how severe hypoglycemia unaware. I've also heard people try to diagnose themselves and say, oh yeah, I'm hypoglycemic unaware. Well, wonderful. Who told you this? Oh no, I just see it in myself. Get it checked out. Be realistic. Your doctor can set you up with a plan. Maybe decide that a pump can work best for you. But try to keep your blood sugars, I'd say about 5 for most people. 5 to 8 is ideal. An 8 blood sugar isn't bad. Anything over 10, we start to worry about. If your blood sugars get above 14, you need to do ketone tests. Always important. Do your best. Keeping your blood sugar within range is your best bet. Keeping it lower than what's in range is not a good idea. Speak to your doctor about where you should be and where the best range for you to sit at. Make an appointment. If you're experiencing that you're always low and you don't feel that you're feeling the lows anymore, get a hold of your doctor. With that, have a super day and we'll talk later. Bye now. My email is mikesdiabetesworld@gmail.com. mikesdiabetesworld@gmail.com.